Hey guys! We're nursing students from Regis University and we're here to talk to you today about how to rotate your injection sites and properly use an insulin pen. It's really important to rotate your injection sites because if you inject your insulin into the same place every time, you can develop scar tissue. And when you inject into scar tissue, the insulin is not all the way absorbed into your bloodstream, and that can cause high blood sugars. It can also cause random low blood sugars if the insulin is absorbed later in the day than when you first inject it. When you are choosing an injection site, you need to make sure that it has lots of fatty tissues, such as the back of your arm, on your tummy at least 2 inches away from your belly button, your buttocks, and the top of your thighs.
Now we're going to talk about using your insulin pen the correct way. The first thing you want to do is check inside the pen to make sure that the insulin is in fact clear. You don't want it to be cloudy or red from blood. Any color but clear is not okay. Then you're going to take an alcohol swipe and you're going to clean the top of the pen. Just like that. Once that's clean, you're going to take your needle, you're going to remove the film on the top. There we go. And you're going to push down with the needle on the pen directly, turning it clockwise, righty-tighty. Once it's tight, you can remove the clear white top. Then you're going to choose a site based on the instructions you got earlier in the video. Once you've chosen a site, this is going to be ours today, you're going to clean that site with an alcohol swipe in a nice circular motion. There we go. Great. Now that your site is clean, you can remove the green cap, which is going to expose the needle.
And we're going to make sure that we're keeping the needle upright vertically at all times.
That's right. Once the needle is exposed, you want to make sure you're not waving it around or anything, and then you're going to turn the dial to the number 2. Once it's at 2, you're going to push the bottom while maintaining that vertical position, and you're going to see a stream come out. This is to ensure that you're getting insulin in your body and not air. Now, or if you don't see the stream coming out, you want to repeat that process one more time. Now you're going to turn the pen dial to the correct insulin dose. In this case, we'll use 5 units. Once that is complete, you're going to take your site and you're just going to pinch it a little bit. When you're ready to inject your insulin, you want to make sure that the pen numbers are facing you. Perfect. And you want to make sure your hand is in a position that you'll be able to press the button so you're not fumbling around with the pen after you've injected it. Now you're going to inject into the site. You want to ensure that there's no dimpling. That is what dimpling looks like. Beautiful. You're going to, after you press the button, you're going to keep the pen in for 10 seconds, ensuring that you see the numbers go all the way down to 0. Once you are ready and it's been 10 seconds, you're going to release that pinch. You're going to remove the pen. Beautiful. And then you want to turn it back up vertical. You want to take that white cap, not the green cap, and you want to turn that left. Lefty-loosey. Once it's off, you want to make sure that you put that in the sharps container. Now when you remove the pen, you might notice that a little bit of insulin has leaked back out. That's just something you want to take a mental note of, because later in the day you might notice that your blood sugars will be a little bit more increased than you expected. You do not want to try to guess how much insulin came out and then try to replace that amount of insulin. Just make that mental note and you'll be fine. It's also important that you remove the needle immediately after injection to try to decrease your risk of infection. I hope this video was helpful for you, and
Thanks
thank
for
you for
watching.
watching.